Hey everyone, it's Dr. Glenn Vo. I am super excited to just have on a friend of mine. Someone who's basically taken care of me ever since I graduated from dental school. Actually, I met him as a dental student, and to this day, still educating a lot of dental students and taking care of dentists such as myself. It is Kyle Wallace with Wallace Specialty Insurance, but also some of you guys will know him from Risk Strategies for Dental Practice. Kyle, welcome to the podcast. Welcome back.
Thank you. Thank you, Glenn.
Well, Kyle, I'm just gonna dive right into it. So we were talking about this. Man, this is like almost like an issue that every dental practice owner has, and heck, I would even say any small business owner, and that is just coverage when it comes to medical insurance. We were just talking about it like a few months ago, and then you had reached out. You said, "Hey, I got some amazing news." I said, "Well, hold that thought and share the amazing news here right with us." So, Kyle, tell us what's this amazing news. Let's talk it through.
Well, the big problem that we found when the Affordable Care Act came
Yeah.
into vogue several years ago, well, it's kind of been 6, 7, 8 years ago now, quite a while. It was during the Obama administration. We're almost
Seems like
going into
yesterday.
another.
Seems like
Uh,
yesterday.
I know it does, but though it might have been, excellent legislation for the country, it created a problem for small businesses. And since my clients are, the
Yeah.
dentists in the dental community who own small practices, all of a sudden they found themselves in a situation where uh, they had characteristically the owner of the practice had purchased health insurance for themselves and their family. And usually because, dentists earn a decent living, they provide themselves and their family decent health insurance. And for the most part, the employees of the small dental practice, some wanted health insurance through the practice, but most didn't. Most either were young or they had coverage through their spouse, but it wasn't necessarily a big deal to the majority of the people in the dental practice. So it created a problem. The dentists themselves would go out and try to find coverage for themselves and their family. And the first thing they found was they could no longer get PPO level health insurance. They could only find HMO level health insurance. And the challenges with an HMO are, first of all, smaller networks of doctors and usually no or very little coverage outside that network. So, and again, also with the ACA came higher and higher deductibles, and let's face it, higher prices. When you roll everybody in the country into a system and you supplement those who can't afford health insurance, well, who pays? And we all know it's the people who can't afford it, and so it created such a problem that for the first time in my 35-year career of working with dentists and dental practices, I actually got involved in health insurance.
Yeah.
I'd
Yeah.
always, I'd always left it alone because, well, let's face it, I always thought of health insurance as no win. No one likes it. Everybody complains about it. It's really expensive. Me too. I feel the same way. So spending years learning about it, and part of the benefit of joining Risk Strategies, which is a large national insurance brokerage, gave me some tools to work with. And one of the first things I started to look into was, what can we do to create a better health insurance environment for our better health insurance options for our clientele. And we've been working on it for over a year now, but we've been able to create an alternative health insurance plan specifically for dentists and dental practices. And what's different about it is that, well, first of all, it's going to be priced at roughly 30% below what traditional health insurance
I mean, that sounds amazing to me. I mean, that you got me right there at 30% below.
it's a lot of money. Now, there is unlike ACA, where it's 100% acceptance. There are some health insurance questions, and it is loosely underwritten. So not everyone will qualify, but in our experiments with this program, probably 85% will.
Oh,
And
okay.
so I think that's really good. The other issue that we've had with traditional health insurance practices is that participation requirement.
Oh, yeah.
The requirement that 75% of the people in the practice participate, or you can't do it. Well, this program's only going to require that 2 people in any practice
Oh,
participate.
wow.
So that's, if there's 2 doctors, the 2 doctors, a doctor and a hygienist, but only 2 people in the practice have to participate to get in. The other really important aspect of this is that for surgery cases or other pre-qualified type procedures, that if you work with a care coordinator in practice, it takes the deductible and moves it to 0. So there's a 0 deductible on any procedures or treatment that you've worked with a care coordinator in the program for. So
Kyle, I have to ask you this because, first of all, that sounds absolutely amazing for someone who owns their practice, such as myself, and I know so many other dental practice owners. That's always in the back of their mind, right? Like, what am I going to do with my family? Oh man, the way the rules are written, the type of coverage, it's almost like it's not even worth it. It's probably better for me to just pay out of pocket. This sounds amazing for dental practice owners. Now, my question to you, because everyone's probably listening to this right now, and they're thinking, okay, that sounds too good to be true. Everyone's gonna be thinking that, right? And right now, I'm listening, and the reason why I'm thinking, I'm like, okay, it is too good to be true, but I trust Kyle. And we're gonna talk about like all the other things. We just jump right in because this is such big news. But Kyle, I've been working with him for years. He's helped me and so many other doctors. There's a whole group of us, so we trade stories like, oh man, Kyle bailed me out of this with this issue with a patient. But for those who are saying this is too good to be true, and they're like, well, how do I look into this? What does it take? Like, do they just need to reach out to you and literally they fill out an application and they'll find out if they're the 85% or if they're the unlucky few who can't qualify? Like, how does that whole process work?
Well, that's what's taken us a long time to do.
Yeah.
Once getting the rates in order was a challenge, but then there's the challenge of how do we make this easy?
Yeah.
So we've set up a link to a website. It's you can do it yourself there if you want. But the nice thing is we have people on standby to make appointments with who can explain the program in detail and meet with you over the phone, online, to explain the program in detail so that you understand it better. Or if you have questions about trying to negotiate the website, sign up. We've been working through the bugs on the website, making sure it's easy to understand. But you and I both know when you go on to any website and start answering questions and filling things out, somebody like me, I'm going to have questions. So we've got a team behind it to do this. And as far as it being too good to be true, well, there's still a lot of fact in health insurance and the whole medical industry in general. And by, first of all, underwriting it to maybe the 85% of the people that actually qualify, well, you take some expense out. And there's no magic there. The other thing is that, using the care coordinators and talking about 0% deductible, well, there's a lot of negotiation that can go on behind the scenes between health insurance providers and treatment providers. And you don't find a lot of negotiation going on between the United Healthcares and the Aetnas and the Cignas. They have a tendency they're gigantic. We all know they're monster sized. They pre-negotiate things with hospitals and providers, and there's not a lot of negotiation after that. But if you've got people that are negotiating cases and managing cases, you take cost out and you can pass that cost back.
I mean,
to
it makes all the sense in the world. And again, it's a lot of times when it comes to plans like this and different services. I mean, that's why it's good to have someone who works in that particular industry on our side, someone like you, Kyle. So again, when you told me about this, like a few months back, you're like, I'm working on something here. There's little things we had to work out. And then when you told me, look, I have some big news, we had to bring you on here. And so this is amazing. And again, guys, we will get the link to that site for you. And Kyle's team is amazing. When he says there's like an easy button, he really means it. And here's the thing. Let me ask you this, Kyle. I mean, is there any kind of like any kind of risk or obligation for someone when they go through this process? They're not paying something up front or anything like that, right? Like they're going to go through this and then you and your team will let them know if they qualify, correct?
right. Yeah, no obligation at all. You come on, you'd find out if you qualify, what it would cost you, compare it to what you're paying now. And then the people on staff would walk you through the process of entering this program, making sure you were accepted, you were active before you cancel your other program. It's not, and then the other thing about this is it's not something that has to wait until open enrollment at the end of the
Oh,
year.
that was going to be my follow-up question
Yeah.
because again, we
Right.
actually just went
If
through
you
open
have
enrollment.
United Healthcare or Blue Cross Blue Shield or anything right now, you could enter this program June 1st, July 1st. It
Wow.
doesn't matter because it's not, it's not part of the traditional healthcare program. It's
Well, I think this is amazing. I mean, again, you have for those who are watching and listening right now, I mean, you have everything to gain and really nothing to lose. Oh, the only thing you're gonna lose is a little bit of time. But here's the thing: the upside is if you qualify for this, and again, 85%, right? I mean, again, not everyone, but pretty much almost everybody. But the upside is you're gonna get better coverage, better rate,
right.
and literally you have someone who's going to watch your back and walk you through the whole step instead of you becoming like your own benefits person. Because most, let's face it, most dental practice owners who are just by themselves, they're researching online. They're looking around. They're their own benefits people. But again, imagine working with someone like a Kyle and his team, because I've worked with them before for many years. That's amazing. Okay, so I'm going to switch gears, Kyle, because I have to share the story with everybody. And I'm almost embarrassed to say this, but again, I've been practicing for 15 years now, and I would say there's only two, so that's kind of good. I have two situations where I really needed Kyle to bail me out. And it was with patients, and Kyle was the working with me with my malpractice. And whenever I get that letter, that scary letter that someone's suing me, I mean, the first person I call is always Kyle. And generally, Kyle, correct me if I'm wrong. Generally, I'll send you a message, and it's probably like really late. It's like on a Saturday, and you're already in bed. You're already doing something. You're on a trip or something. I always send it then. It's like a frantic email, and he always comes back, and we get on the phone, and he just talk it through. And most of the time, whenever I've been threatened with a lawsuit of some sort or whatnot, and nothing ever happens because Kyle walks me through that. I share that story with you guys because it's happened to me a couple of times. It's not just me, a lot of other people, but a lot of you who are watching and listening right now, you've probably gone through that situation. Hopefully, you had someone like Kyle on your side. But for those who didn't and had to suffer kind of in silence and just go through all that anxiety and fear on your own, I'm sorry you went through that. But I'm going to tell you right now, you don't have to go through that. Why? Because you can work somebody like Kyle. So Kyle, did I exaggerate at all? Most of the time, the times I've messaged you, it's like on the weekend, and I can't be. You have to let everyone. I can't be the only one person that does that, right? I do. Kyle does make me feel like I'm like the VIP client, like I'm the only client he takes care of. I know he has a lot of clients, but I will tell you, I feel like the VIP each time I talk to him. But Kyle, I mean, that's not an uncommon story, right? Like, I mean, people sending you a message at the wee hours of the night, just saying, "Oh my gosh, my career is over because of something." You get a few of those, right?
It's actually yes. Yes is the answer to that. I do. And it's to me, it's one of the most important parts of the job. And now that I've got such a large staff and they handle a lot of the sales and service of insurance policies, this is the part of the job that I've kept for myself. And it's because I know how it feels to be scared when something comes up. And let's face it, it's business, but it's even more personal than that when you're treating patients. And when something comes up, if you're human, it's going to scare you. You're going to sleep. And for me, that's the most important thing that I do. And yeah, it doesn't matter when it is. If people email me, I've had conversations with dentists sitting along the Grand Canal in Venice, talking about patients are, because it's also something you want to address right away. So yeah, it's part of the job I love, and it's because hey, it makes me feel good. It makes me feel good to make my clients feel better.
I'm so glad that you shared that because again, there's so many there's some amazing companies out there, so many amazing professionals out there in this space helping dentists out. But I will tell you, not everyone is like Kyle because I've heard it from other people. And so again, if you have ever been in that situation and you felt like no one was listening to you, I encourage you. I mean, obviously, there's this great health insurance plan, right? You should be reaching out to them as well. But as far as your malpractice, you definitely need to reach out to Kyle. And another thing I want to bring up really quick is, and it's something I've been working on, and I have to admit, I've been kind of dragging my feet on this, but we had a conversation earlier before we jumped on about just liability in general and just protecting yourself. And Kyle's for years been saying, you might look into this umbrella insurance policy. And I finally said, okay, Kyle, you got me. I need to get on because the thing is as we're growing in our career, I mean, I started working with Kyle right when I got like I mean, again, I'm going to date Kyle here. Like 15 years ago when got out of school, right? Like I was sitting in an auditorium at the time, it was Baylor College of Dentistry. Unfortunately, it's called Texas A&M now. But I was sitting in an auditorium and I was listening to Kyle talk, and he was lecturing something that he does and he's very passionate about is lecturing at all the dental schools. And I was like, okay, I'm going to work with this guy. But way back then, and so my life has changed a lot, have more kids, have more assets and whatnot. And whenever you get more assets and whatnot, you got to protect them, right? And so again, that's something. And Kyle, can you just, spend a little bit of time and talk about the umbrella policy? Because there's a lot of other doctors that are in my situation or maybe a little further along that, it's good that you're doing good, but that means that you have more blind spots that need to be covered. Could you talk about that and why it's so important that as dental professionals, as you're growing your business and all your assets, that you should get the right coverage?
Yeah, no, and I'm happy to address that. Yes, it's okay. So we all buy personal lines insurance, and when I say personal lines, I mean home and auto insurance.
Yeah.
If we rent an apartment, we have renter's insurance. If we own a home, we have homeowners insurance. We drive cars, we have car insurance. And those things are, especially you and I are in Texas, it's getting really expensive here to buy those things. And we look at those and go, okay, how can we get the best prices for that kind of thing? Are we going to call Flo? Are we going to call the Gecko? Are we going to, everybody's talking about, saving money on it. And we get focused on that. And as professionals, there's more to focus on. And one of the things is, what are the two biggest things at risk? It's not cheap car insurance or cheap homeowners insurance. Certainly being conservative about, looking at your options and buying it is important, but what it really is it's, hey, what if I have at risk? What if I have a car accident? What if it's my fault? Are they going to sue me are they going to find out I'm a dentist and that I'm successful and sue me for everything I have? Or what happens if it's not my fault and I'm injured and I can't practice for a while or maybe forever? And so we did come up with an umbrella program specifically for dentists again a few years ago. And though every umbrella policy is going to have coverage for you and your family members if you do something wrong or allegedly do something wrong and it causes someone else serious property damage or injury, that's the easy part. Most every umbrella is going to pay up to the limit you carry, whether it's 1 million, 5 million, 10 million, 15. I think I'm carrying a $15 million umbrella right now, just to give you some idea that, that I believe what I'm preaching here. What our umbrella program does that's different than not all, but most, is that you can add coverage specifically for car accidents, which is the biggest risk we have of being hurt ourselves. If someone hits you and it's their fault and they injure you as a working dentist and you can no longer work, yeah, you might have disability insurance. Most people's disability insurance is insufficient because most people don't carry the limits that they need, or even can get the limits maybe that they need. And you have health insurance, as we've talked about earlier, but an umbrella policy that has what we call underinsured motorist coverage acts as the insurance for the person who injured you. So these people may run into you and injure you to the point where you can't practice for months or years or whatever. Well, most of them are carrying state minimum insurance. If they're carrying insurance at all, it's not going to pay you anything. Maybe $25,000. How far is that going to go?
Yeah.
But
maybe fix your car, maybe. But as far as you being able to work and whatnot, that's a scary thing. When you were bringing that up to me, when you were talking to me about, bro, that's scary because again, if you can't work, life still goes on, right? Nothing stops for you.
And the biggest claims we have in this umbrella program are just that. They're doctors who are injured in car accidents who can't work for some period of time, and the party that hit them has insufficient insurance to address that situation. And the underinsured motorist portion of the umbrella policy acts as the insurance for that party that hit you and will pay that claim up to whatever the court deems is the proper settlement, or whatever the insurance company negotiates for ongoing care and treatment. But basically, it doesn't leave you hanging. And that's such an important piece for someone who's got 10, 20, 30 years left to work. It's a coverage that I wouldn't want to be without.
Well, again, I wanted to bring that up because that's guys, just to let you know, I'm in the process of just getting this done myself, because you never know, right? You never know. We work so hard to protect ourselves. We get the right coverage and whatnot to protect ourselves in our practice. But we sometimes forget that there's other issues as well, especially when we get more assets, our businesses are growing, we have more responsibilities. There's a lot of things that can happen outside the four walls of your practice, right? So again, you're protecting yourself. You're protecting yourself in your four walls of your practice. You're protecting yourselves in the four walls of your house, okay? But what about when you step outside and there's so much risk when it comes to for yourself and others onto you and your family. So I wanted Kyle to talk about it. I'm going through that as well. So Kyle, I always joke around with you that I'm lucky because I actually have access to the bat line. And I call the bat line Kyle's cell phone. When I have a problem, I literally text the man. And I also send him an email too, because I'm always kind of like, I want to make sure he gets everything, but he always gets my text. But I have access to the bat line. Kyle, can you, you have multiple bat lines, right? You got the main bat line at the practice. You got your own bat line. Can you share? Let's share with our community like a number, a bat line, so that they can send a message or they can call right away. Again, you guys can go to the website. We'll have it in the comments. But if you just want to, if you run into something and you're really scared or you just have some questions, I can tell you, Kyle and his team. In fact, I ran into some of his team members at a dental meeting. They happened to be there, and I was asking them questions there. They love it. The relationships is really important to Kyle and his team. But for someone who has questions, right? Because Kyle, you answer all my questions, you answer everyone else's questions. What's a good number for them to call? What's a bat line number for them to call here and get some help?
You know what? The bat line goes to the alternative cell phone, and I do not have the number on me right now.
Okay, well, I will get that bat line because I have it right here.
I can holler out the phone to Aaron.
Is it 972-663-5190?
That is a good number. That is not quite the bat line number. That will take you to a recording that says, hey, if this is an emergency, call this other number. But I do have a bat line number, and you caught me off guard because I don't have it memorized.
It's okay. We're going to put the bat line in the show notes, in the comments. And again, why am I saying call a number instead of going to the site? Look, you can go to the site and see everything that they do. But I'm telling you, whenever you talk to the team members, whether it's Kyle or Aaron, I've been talking to Aaron, who's been there for a while. She's been with you for a long time, Kyle. Just they absolutely love just talking to clients and learning what we're doing, what we're and being a resource, right? Aaron's brought up a couple of things I should be looking at. I think, oh, really? She's like, yeah, Dr. Vola, did you know? That's a whole different conversation, but apparently I'm very underinsured when it comes to my house. Because, well, I'm lucky. I'm in Texas and things have gone up in value. And she's like, you're a little underinsured. I was like, really? I was like, but I bought that. And she was like, yes, you bought that like 7 years ago. So anyways, you never know. You reach out. But Kyle, so we're gonna get the bet line. But before we log off here, any comments or last words to our listeners before we log
Oh, last words.
off? Last good words. Last good
Last
words.
words. Yeah, take a look at this health insurance program. It will take you, shouldn't cost you more than 30 minutes, 45 minutes of your time to really get the gist of it. And it may be just, it may save you thousands of dollars and make your life a whole lot easier.
Well, I love that. And again, what you magic to my ears is that magic words to my ears. What you said, yeah, we just missed the open enrollment, but no, those rules don't apply here. You can literally just reach out and see, and again, you have nothing to lose and everything to gain. So, Kyle, thank you so much for just following up with me with that, because I know we've talked about that a few months back. You were really excited. You're like, but I want to make sure that this is really easy. So, thank you so much for reaching back out. And guys, literally, when he told me, I was like, you're coming on the podcast and I'm putting you on the spot right now. I'm not sure what you're doing, but we're jumping on right now. So, Kyle, thank you so much for jumping on. Guys, thanks for tuning in. I'll get the number, check out, call the bat line. You'll get all your, not only for this particular program, but other things that they do as well. You guys know how long I've worked with them. No question is a dumb question. Reach out to them. You'll see why I've worked with Kyle for years. So, Kyle, thank you so much for everything you do and for coming on.
Thanks,
guys. We will see y'all next time.